Yeah.
So, hey, what's up, Sid? How are you?
I'm good. How are you?
Excellent. I'm gonna go work with, what's your pretend name?
Jessica.
Oh God.
No, I'm Jessica.
Corn.
Corn.
That's not nice.
It could
How
be
about,
Candace. Rebecca.
No, it has to be ridiculous.
Sue. Cornelius.
That's Sheba.
Betty Lou. Betty Lou.
Patricia.
Patricia? Okay, sure. I don't know why Patricia, but how's Patricia doing?
She's great.
Excellent. We're gonna pretend this is an outpatient clinic, but you still kind of check in with a nurse, okay? So, okay, I see she's on medication. Do you know if she's had any recent infections? No.
No.
Oh, good. That's great to hear. Okay, how was she as she walked in? Did she trip or fall? Yes, almost.
Almost.
Oh, okay. Does she have any assistive devices with her?
No.
Yeah. Okay. Yeah, okay, cool. I'll let you know how she does. All right. Hey, how's it going?
Good.
Yeah. My name is Liz. I'll be your PT today.
Yay.
Yeah. I read your chart. Getting tired there?
Exhausted.
Yeah. Do you have a lot of issues with fatigue?
Yeah, I do.
Tell me about when that happens.
It usually happens about at the end of the day.
Oh, really?
Yep, I'm a landscaper.
Oh, yeah. Is the heat an issue for you?
Oh,
Yes, yes, it is. Yeah.
Mhm.
How's it with your kiddo in the evenings?
Oh, they're good. I have them help me out quite a bit because I'm so tired.
Yeah. Your 2.5-year-old? That's impressive.
Yeah, she helps. You gotta start them young, you know.
So, yeah. My 2.5-year-old is like way too obnoxious to be helpful.
Yeah.
But, yeah.
Mm-hmm.
Yeah, just imagine me with about 50 times more energy. That's kind of a lot. So, okay. I can't remember the order of things we're supposed to do then. Vitals equipment is here, my environment is managed. Yes, okay. Is that being?
Drawing a card.
Oh yeah, I'll draw a card, somebody give me a thing to examine.
Crayon arms.
Okay, cool. So I'm gonna take a look at a lot of different things today, okay? From your movement to kind of like how your eyes move and all sorts of things, okay?
Okay.
Now she would be in a chair with a back, so you're okay to let go, okay? She's just here like this for now. Okay, so I'm gonna ask you to do a few things with your face and your eyes, and you just kind of do as I do, okay? All right, so can you follow my finger? Keep following, keep following, keep following, keep following. All right, lovely. Okay, looks very good. Do you have any issues with smell?
No.
Taste?
No.
Good. Can you swallow for me? Great. Okay, can you clench your jaw? I'm gonna touch on your face like this. Tell me if it feels the same.
Feels the same.
Good. I want you to raise your eyebrows up like you're surprised. I want you to scrunch your eyes closed. I want you to wrinkle your nose like it's a terrible smell. Good. And then for just half a second, go ahead and pull your mouth down for a second. Okay. Frown for me like you're so sad. Oh, okay. Now open your mouth and say ah. Great. And stick your tongue to the left and the right. Brilliant. Go put your mouse back on. Good, good, good. Okay. As best you can, step on your own. Turn on this side. Raise your shoulders up. Good. Hold it there. Good. I want you to use that. You need that, huh?
Mm-hmm.
Yeah. Does that happen at the end of the day?
Yeah, it does.
Okay. What color is this right here?
Pink.
Nice. Okay. Did I get them all? Oh, one more. Does that sound safe?
Yes.
Good. All right. Cool. Let's see. So next I need to check your tone. Okay. Let's say I draw the card for upper extremity tone. Okay. And again, let's pretend you can see back. Okay. Cool. All right. All right. So you just stay nice and relaxed for me. So I want you to give me a 2. Okay. On your elbow. Okay. This feels like a 2, sort of.
You need to study a little bit, I'm sorry.
Not the 1+, but
Yes,
that's okay.
yes it is. Good catch.
Okay. Any discomfort with anything I'm doing?
No. Sorry, I stopped trying.
That's okay. Alright, can you lean over that way?
Mm-hmm.
Just stay there, okay? the bathroom. Just kind of seeing how things move. Cool. Coordination. Okay. I want you to take this hand and do this. Boop, 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 boop. Oh, lovely. Can you do that again? Brilliant. Okay. I want you to take this heel and slide it up your shin real smooth and bring it back down. Suck it, okay?
Suck at it?
Like jump and start. Oh, okay. Good. And then bring it back down. Now the other one. Yeah, so like kind of fast and then slow. Yeah, that's what abnormal looks like.
Okay.
Good. All right. Okay, so we have assessed coordination, we have assessed tone, we have assessed cranial nerves. Now I need to do balance, seated and standing. So a seated and standing balance screen is mostly assessed through perturbation. So nothing wild, just make sure they're not using their hands. So if they've got a hand here, go ahead and bring it here. Sit real nice and tall for me, chest up, chest up, chest up. Stay right here and don't let me knock you over, okay? And I promise it won't actually be like that. That's just the cue I give so you know how much I'm to do in your spine. Ready? Just little nudges here. So this looks like it could be trunk ataxia or possibly a tone alteration. Okay. Otherwise I can just see statically you look okay. Alright, cool. We'll be standing here in a second. What else is next on my sheet?
Screening to relevant diagnosis.
Yes. Let's see, do you have any issues using the restroom at night? Do you feel like you have to go a lot? Say yes.
Yes.
And during the day? Yes.
Yes.
Okay, that's good to know. Is this something that you feel like you might fall at night because you're like in a hurry? Yes. Okay, so we've screened. Okay, we'll kind of explore that later, okay, because I don't want you falling ever. At least when you use the restroom. Okay, what else?
We have functional strength, we have gross motor.
Okay, so, all right, you get to put one on the back. Okay, put your arm in front. Let's pretend you have the back. Okay, actually gonna do both. Hold both arms out like a zombie, keep them right there. Good. Go like this. Keep it right there, don't let me pull. Good. Good. Straighten your arms out. Palms down. Relax, relax, relax. Don't let me bend you. Hold it straight.
Oh God, sorry.
It's okay, it's okay, that's all right. Good. Good. All right, wrist up, hold. Good, wrist down, 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 hold. Good, squeeze, 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 looking in it. Good. A little weak there. Just messing, you're fine. All right, hold. Good, palm towards me, push down. That's an alternate way you can do triceps if you like. You guys pick. All right, wrist up, hold. Wrist down, hold, don't let me pull it up. Down, 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 good. There you go. Squeeze, like you mean it, like you mean it. Good. Give me starfish hands. Okay, okay, good. All right, so there's a little functional screen there of the upper extremities. In the interest of time, we'll tell you uppers or lowers, okay? I'll go ahead and do lowers so you can see what it looks like. Okay, remember to guard. Lift this leg up, hold, good. Lift this leg up, hold, good. Straighten this knee out, hold, good. This one too, hold, good. Relax, keep it bent, don't let me pull you, good. Keep this one bent, don't let me pull you. Push your knees out into my hands. Push your knees together into my hands. Good. Toes up. Good. Toes up. Good. It's just a screen. Yeah. Okay. Now what?
One additional non-motor screen.
That would be the urinary stuff. Yeah. Okay. Next.
The mobility transfers as indicated. Not indicated.
Not terrifically. Your balance isn't super great actually and seated, so actually I wouldn't mind seeing one soup to sit transition. Pretend she has a chair at the back. Alright, my friend, go ahead and lay down all the way. Scoot yourself back. Oh, that looks good. Triceps look good. Come back some more. Good. Go ahead and lay down. Real gentle. There you go. How do you like to get out of bed? Go and do your real one, whatever it is, to come up and sit on the side here. Okay, okay, that's not bad. I don't think Dr. Sexton would hate that, so that's good for your pelvic floor. Good. All right. The crunch up and then twist overs are the ones that she would get unhappy about in terms of pelvic floor. It just like puts all your Valsalva down. So, okay, I'm happy with that. I'm not worried about it. Okay, so next is gonna be sit to stand. So, let's see. So what I want you to do is to go ahead and scooch up until your feet are on the ground. Good, good. And when you feel ready, go ahead and stand up for me. I'm just gonna hover just in case, but stand up as you do normally. Go ahead. Oh, very nice. Okay, are you comfortable to take a seat?
Yes.
Good. Good. Okay. How'd that feel? Say weak.
Weak.
And like you don't know where you are.
Mm-hmm.
Yeah. Yeah. Okay, so at this point I could turn and say her sit to stand is terrible. We need to work on that. Basically what I'm seeing is that it's asymmetric. Given that her strength was fine, right? The strength was fine. It was symmetric on both sides without any issues. I'm gonna say this could be mostly kind of a balance or possibly trunk coordination problem. If I had to guess, there's a little bit of truncal ataxia that's been there for a while. And over time, it's altered her sense of center, and she's just kind of relying on what's like her strong leg. The tone was fine in both lowers, so I don't think it's tone. I really think it's pure, like just kind of trunk balance in dynamic situations. So she's not retropulsing for me or anything. She's not doing anything weird. She just kind of doesn't have great balance when she sit to stands. So what we're gonna do is we're gonna go ahead and try a partial. So let's get Liz a stool. Oh, thank you, Christian, for not giving me something that's up in the sky. Okay, so I want you to go ahead and work on your sit to stands, okay? So can you put both hands in my hand? Did you ever swim? Really? Oh, okay. Well, then this will be so much fun. We're gonna pretend like we're diving forward to start the kind of evening you out. You're putting all your weight over here and leaning over it, right? That makes it real hard to stand up clean. So we're gonna force this leg to work, okay? All right, scoot forward a little more for me before you do. Scoot more. There, right there. Okay, both hands in mine. I'm gonna tell you first, okay? So we're gonna lean forward because you gotta get your nose over your toes in order to stand up well, okay? So we're just gonna lean, we're not gonna do anything else. So lean forward at the hips and come back up. Okay, don't use here, use your hips. Good. I feel okay?
Mm-hmm.
No pain in the hips? You don't feel like too scared or anything?
No.
Good. Notice how I'm blocking her? She's very safe. I've got her here too. Okay, so on this next one, I want you to kind of pick your bottom up and press through your toes and your heels like you're just kind of lifting. Just a little bit. So here, now lift up and come back down. Good. Here, and come back down. Good. Okay, so that is my baseline intervention. If she had trouble with it, which she could end up like diving and like go give me this, right? Then I'm gonna make sure that this is cleaner. So I would say, can one of my lovely techs get one of the large stability balls for me?
Yep.
All these things will be out, team, and if there's something that's perfect, yeah. All right, both hands on this. I'm gonna gently roll it forward, just a little, okay? All right, ready? Stay even, stay even, stay even. Good. Come back up, so this is a regression. Good. I'm pushing down right here so that she knows she has to stay even, okay? So I'm tilting her that way just a little bit. And I'm also on this side so she can't like, she'll have to crash into me if she wants to be asymmetric. So she's here, all right? If she was good at it, go ahead and put your hands by your side. If she was good at it, then we'll actually do the top half of the motion. So that's the final part of the motion. So what I want you to do is go ahead and think about leaning forward, pushing up to stand. Good, go ahead, yeah, go ahead. Right here, and then I want you to stand up all the way, tall, good, and then come into a half sit. So it's gonna be like a squat, okay, come back into a squat. Here, pop, up, good. I know. Okay, come back down. Right here, feel this muscle, good, there you go, good. Okay, so the top half of the motion, to finish it, to come up to tall. All right, go ahead and take a seat for me. Lovely. All right, next is we're gonna walk around, okay? So I'd like to walk around over here against this counter. Do you ever use a cane or anything? Say no.
No.
How are you gonna hold on to your baby? So I understand you're having some difficulty putting your kiddo like in the car or carrying them, right?
Yes. Yeah, that's the classic.
Okay, so she's in a chair with a back, so she's okay for a second. setting up, again, if she's in a chair in the back, you're okay to leave her alone. You really are. When you're ready, we're gonna go ahead and come up to stand. You better do that nice sit to stand we just did. Love it. Let's go over there and give you some ataxias. Good. What we're looking for here is proper guarding and for you to be observing the patient as they're going. All right, so her trunk is flexed throughout. She has a decreased swing phase, extended stance phase bilaterally, midfoot contact. You're sitting in a chair with a back, okay? Couldn't quite see your swing phase as well as I would have liked. So you can grab this if you want, but you don't have to. It's there if you feel you need it. That's how you don't. Okay. All right. Give me that gait pattern again. Go ahead. Inconsistent heel strike on the right. Good turn. Swing phase. Go ahead. Reduce knee flexion. Lack of terminal knee extension on lefty, and no, extends fully on righty. Okay. So there's like a bunch of things. Just whatever you see, okay? That's what it's gonna look like. It's hard. You're guarding them. We're watching you. I know. Practice this, okay? One thing to help you practice this well, your partner, do goofy things. Push it, okay? Be a pain in the neck, all right? That'll help prepare you for whatever the SP gives you, okay? All right, so it looks like you're having some trouble bending your legs. Surprise, surprise. So what I want to do is I want to try going over this hurdle, okay? Okay. So on this first one, you're going to kind of sneak it in. I want you to crash into it just a little bit with one of your feet. Okay. Go ahead. Oh, okay. So I need to regress this, okay? This is too hard. Let's go and sit down in your chair with the back. Sit right there. Good. This is a little too high. Let's make this a little more achievable. On this next one, I want you to go ahead and come closer. Oh, I love it. Very good, Patricia. All right, you're gonna march that knee up, really exaggerate it, and place. Heel first. Come back. Good. Pick that up. Heel first, girlfriend. Yes. Music. Pure music. Up. Ah, so gorgeous. Stop. Good. All right, so there's the regression. The progression. Go ahead. We're gonna come back to the baseline intervention. Good. Up and over. Good. Other side too. Good. All right. So there's the intervention. Now, if I wanted to do more of a participation thing, so that was just her basic function, right? That's not so much her participation. Her participation, again, you're seated in a chair with the back, everything is safe, would be doing something a little more functional with her pretend baby, okay? So while this is not the weight or parameters or anything, it's close enough, right? And that's all you gotta do in clinic is close enough. So I would say that the hard thing for you is going to be this motion. Yeah, that's gonna be really hard. So can you demonstrate that for me? Over here to the counter. All right, so as you go, I want you to kind of like lose your balance like that as you're turning, okay? Okay. All right, go ahead. I gotcha, yeah, okay. And then bring the baby back over to the changing table. Good, okay. So that's pretty hard. You're having some trouble with transitions.
Yes.
I'm gonna go ahead and use that Parkinson's logic on an MS patient so you can see that it applies different places. Okay, so without the baby, I want you to bend that knee like we practiced, this right leg. So you're gonna lean to the left, bend that right knee, pick it up, and rotate it out toward 3 o'clock. Good, okay, then come back, okay?
Do I have to wear it?
No, you don't. Ready? Up and over, good. Now lean back and put righty back, good. Lean left, pick up righty, put it over, good. Lean into lefty, pivot around. Okay, good. That's the baseline intervention. Let's make it harder because you were good at it. So now I want you to pick up the baby and then pivot, okay? Good. Come back, then put the baby down. Good, step by step, okay? Not all at once. That way you can focus on perfect movement. Okay, so there's her progression. Her regression would be, I think, a smaller degree of rotation With a marker on the floor. Yeah, that's probably what I would do. That way she has like a little visual thing to aim for. I want your toe to line up with that. It's gonna look like this, okay? So it'll be like, boop, like that. Ready? Come on over, little visual cue. There you go, good. Come back over, good. Good, good. Hands on the counter. Good, love it. All right, let's come back and sit down. To your left if you could. Oh, I love that pivot you just practiced. It's so good, yes. I thought we just worked on
Oh,
picking
sorry.
apart. Yeah, thank you.
Wow, Dr.
Yeah.
D, she looks really
I
tired.
know, right? She does. You getting tired on me?
Oh, yeah.
Sit down.
I'm unstable.
Sit down. Look at me. Look at me. Okay, you're a little bit pale. You seem kind of sweaty. I'm gonna take your heart rate, and the tech is bringing me a blood pressure cuff, and I'm putting it on. Okay, your heart rate's a little elevated. You're 110, so you've gotten a little bit tired. So now I've got this nice cold towel here. Put it on. All right, deep breaths. All right, sit up tall for me. Just feel the oxygen. Let's check your pulse ox. Good. Heart rate's coming down. Your blood pressure's stable. So this is just the MS talking. Yeah. Do you ever do any pre-cooling?
Oh, yeah. All the
Yeah.
time.
Okay. Let's say you did it.
I don't.
Okay. Well, my landscape ecology.
Sorry.
friend, your educational topic is going to be fatigue management with a cooling vest. So wear the cooling vest. You want 2 of them. One lives in the freezer, and you can like even put that in like a lunchbox or whatever. You know, one of those things like your dad has. You know what I'm talking about? Yeah. And you put that in with a bunch of ice, and that hangs out there, and you keep rotating them, okay, during the day. Keep the vest on, sorry, especially in the summer, okay?
Okay.
Any old time is good too, though, but you want to do it before the activity. About 30 minutes should do it. So you're able to drive, right? Yes, you
Yes,
are.
yes.
Just put it on as you're driving to work.
Okay.
Yeah, yeah.
Yes.
Okay, cool. So there's your education. What else do I have to do?
That was it. You had your 2 interventions, you did your gait assessment. So your balance assessment and sitting.
Oh, I didn't do standing. Yeah, come up to standing. Okay. It's the same thing. So, can I go and step forward a little bit more for me? No, no, over there. Thank you. All right, stand up nice and tall for me. Close your eyes. So what I would be looking for right here is any sort of sway. If I really wanted to push it, I need to put her on that, which is why I have that out, right? Y'all remember the cat sib? It's a good screen squinting. See if you want, I'll show you. Stand again, don't get on it yet. All right, can you side step? Yeah, you can. Good. All right, now close eyes. So this is looking at her vestibular sense, okay? Now remember, eyes closed on the squishy thing is vestib. Go ahead, come up, eyes open, come up. Eyes closed, no squishy, is sensory. Okay? Eyes open with squishy, hop back up, is visual. Okay? Pretty straightforward, you just take some of them out. Okay. So that way we can see what's working or not working is awesome. Yeah. If you want to be super technical. If you don't, go and hop off. You have options on this. You just shove them around and see what happens. So I'm gonna hang on to you here and I'm gonna give you nudges, okay?
Okay.
This is just to see how your balance reacts. Ready? Good. Okay. Good. So if something were to happen, I've got her, okay? Just like that. See my leg? Yeah, I've got her here. Yeah, she's safe. It's okay. So that's how you just kind of grossly assess balance. Not formal, just kind of getting a sense of it. Okay? All right, is that everything? Did we do it all?
I think so.
Okay, cool. So that gives you all a sense of it.